earlier we start, the earlier we finish. Clerk, do you want to call the roll or just see that 5 people are here? We have a quorum. I think that's okay.
Here.
We have a quorum. Okay. We got 13 bills, I think, and the first bunch are identical. So House Bill 27 from Delegate Carlson is identical to Senate Bill 39 from Senator Favola. It deals with placement of children with foster parents as a matter of kinship care. It has a fiscal impact for both services and maintenance for the budget. Both the House and the Senate budget have covered it.
That's right.
To a certain extent. So we have a motion to recommend reporting, and that's been seconded by Senator Favola. All in favor, say aye.
Aye.
Okay. The next bill is House Bill 570 from Delegate Delaney. It's identical to a bill I carried, the Prescription Drug Affordability Board, and that's both the House and the Senate have included funding in the budget for that. It was a partisan issue, I think. So, do I have a motion to report? Is that second? Second. By Senator Favola. All in favor, say aye. Aye. Opposed? So we have 2 noes. Usual suspects. Okay. House Bill 326 from Delegate Glass is identical to Senate Bill 239 from Senator Hashmi. It authorizes Virginia to become a signatory to the Social Work Licensure Compact. The fiscal impact is indeterminate. We reported Senator Hashmi's bill, and it passed the Senate with 28 votes.
Move to report. Second.
Motion to report in a second. All in favor, say aye.
Aye.
Opposed, no. Okay, that bill's recommended reporting. House Bill 314 from Delegate Hope is identical to Senate Bill 179 from Senator Favola, which passed the Senate 40-0. It deals with discharge planning at the state hospitals. Fiscal impact of the bill is due to the need to hire 2 social workers to conduct discharge planning at Southern Virginia Mental Health Institute in Danville at a cost of $213,000. The existing budget provides a $1.2 million general fund annually for the cost of providing transportation for individuals being discharged from state facilities.
I move to report.
Okay. Okay, we've got a motion to report in a second. All in favor of that, say aye.
Aye.
Okay, any opposed? Okay, House Bill 353 from Delegate Hope is identical to Senate Bill 392 from Senator Pekarsky that passed the Senate 38-0. What it says is that emergency departments have to have at least 1 licensed physician on duty at all times. The fiscal impact on the Department of Health is expected to be less than $5,000. To amend regulations, and they've said that it can be absorbed within existing resources. Do I have a motion?
Move to report. Second.
Okay, got a motion to report in a second. Is all in favor, say aye.
Aye.
Okay. The next bill is 806 from Delegate Rasool. That's identical to Senator 177 from Delegate Favola, or Senator Favola. It passed the Senate 40-0. What that bill says is that it'll have a one-time cost of $75,000 at non-general fund the first year to configure updates, program code changes, and related testing impacting the state's human resource system. It's about nursing staff at state psychiatric hospitals.
Mr. Chairman, that was a recommendation from the Commission on Youth. We wanted to figure out ways for granting our nursing staff at our psychiatric facilities 12-hour shifts. It was something that they wanted, and
Okay, well, the identical bill has already passed the Senate 40-0. Do I have a motion? Okay, motion and a second to report. All in favor, say aye.
Aye.
Okay, that bill is recommended for reporting. The next bill is similar, 831. Okay. Oh, okay, well, and Delaney's the other bill we'll get to. Shin is the next one on the list. Is she here? First one on the call sheet. Okay. Okay, then Maldonado is next, and that's 987.
Thank you. Good morning, Mr. Chair, members of the committee. The good news is that since this bill was first introduced, we changed the language to make it to be clarifying language versus mandatory language, so the fiscal impact statement doesn't apply anymore. And HB 987 helps to clarify that carriers can consider proton therapy and that evidence or justification for the coverage that can be considered expands to that a proton radiation therapy treatment is covered by Medicare, Medicaid, or any other government health coverage or any other type for any other type of cancer, and that a patient's treating physician or radiation oncologist recommends proton radiation therapy for the patient's cancer treatment. It was further supplemented in an opinion by A.G. Miyares in December, noting that proton therapy is the advanced form of radiation therapy that utilizes protons as alternative radiation delivery method, and that carriers cannot discriminate or make it sort of higher standard for use than other cancer treatment therapies. And so I hope that it is the will of the committee to approve the bill.
And I think the delegates accurately described the bill. It was amended to basically, it's not a mandate, it's just a consideration. Second. All in favor, say aye. Aye. Okay. Thank you very much.
Thank you very much.
Next, Delegate Waxman, House Bill 93.
Yes, sir. Thank you, Mr. Chair. Committee members, I'm here to present House Bill 93, deals with the tick-borne allergy alpha-gal to make that a required reportable disease in the state of Virginia. Alpha-gal is Virginia is one of the hot spots for this disorder. It's estimated.
It's a tick-borne. I understand that in Central Virginia, about 2% of the population probably has it, but 20% of the population probably carries some. Can't eat red meat. Yeah.
That is some of the discussion. The problem is a lot of those statistics will come from things like GI tests or people going into the service. A lot of the allergists too are focused on this, so their numbers are higher than the average community. We really don't know.
Well, there were some physicians at UVA that were concerned about the effect of this on the burden of having to report it because it was so prevalent. But I think the way you've amended it, the bill as amended says that the Board of Health shall adopt regulations to include it on the list.
Yes, and I've also spoken with Dr. Wilson since they sent the letter in a few days ago, as well as Dr. Mills-Platt and also Dr. Hart. I think they felt better once I explained to them that part of the reason for the delayment is they will be involved in the process of
and that's really what they wanted. They wanted to make sure that we had plenty of physician input. And when
yes, sir. Yes, sir.
The process where the Board of Health adopts regulations is going to require them to have.
Yes. And it may be somebody from the Board of Health here that can address that if that's a question.
Okay, are there any questions for any members of the committee or motions? Is there, okay, motion and a second. All in favor say aye. Aye. Okay, thank you very much.
Thank you.
Next, Delegate Cole, House Bill 252.
Good morning, Mr. Chair, members of the committee. Before you is HB 252. Which is creating a sickle cell registry maintained by the State Health Commissioner. Over in the House, this bill had a budget item 283, number 8H, which designated $150,000 in fiscal year 25 and fiscal year 26.
There are really two big questions about this bill. Number one, our budget does not have it. Yours does. Mm-hmm. And number two, our chairman was really concerned about the privacy of individuals and really wanted to know what you were trying to accomplish with this.
Absolutely. So this bill actually passed in Texas without any protections for privacy, and Governor Abbott vetoed it. So we changed that in our bill. So this has the ability, if individuals want to pull themselves off of the list, they certainly can pull themselves off of the list for privacy concerns. But basically what this list would do is give the health commissioner a list of people within the Commonwealth of Virginia who have sickle cell, so we all know not all, but for the health commissioner to know what's going on. And then for those individuals who are on the list, for them to be connected with organizations, nonprofit, or medical situations around them in their community so they can have access to that.
Okay, well, we've not seen this before. There was not Senate cognate. Are there any questions from the members of the committee?
Mr. Chairman?
Senator Favola.
My health subcommittee, Health Subcommittee of Ed and Health, actually heard this. The debate or the public comment was around the need to get a better handle on the extent and probably the scope and extent of sickle cell disease. We want to keep pushing the research envelope, and this might be a piece of that. That's how the public debate went.
Well, we haven't heard, you took public testimony there?
Yeah.
Okay.
Of course, it was voted out by.
Yeah. So the question really is that this is covered in the Senate, in the House budget to the tune of over $400,000 a year. We don't have anything in the Senate budget. So we'll take a couple of minutes of public comment if anybody is here to speak about the bill. Okay. What's your pleasure?
Good.
Mr. Chairman, I know we don't have money in the Senate budget, so I don't know what the protocol is. I do think this is a good idea.
It's a good idea. There's no question about it.
I mean, I would move to report and see if we could negotiate something. Unless that's just not our protocol.
Well, we can recommend report and go to the full committee and then let the chairman take a look at it if you like. I mean, her concern basically was privacy, and also the budget standpoint.
Absolutely.
Two concerns.
We can recommend reporting and then let the full committee take a look at it if you like.
Oh, thank you.
Okay, so there's been a motion to report in a second.
Any way, and maybe staff can look at this, any way to skinny it down. I was shocked to see the magnitude of the fiscal impact.
And I think from what I heard on our side, it was a lot of money because it's a new program that's being started. There's a kickstart, I guess, for 3 positions, and once the program has been moving forward, they would only need 2 positions. For the first 2 years, they needed those 3 positions, and then it continues to drop down each year after that.
Delegate Colt. Mr. Chair,
Senator Boyska.
just one question before we get going. Delegate Colt, Mr. Chair, I'm wondering if we have a concept of how many people have sickle cell in Virginia? Or is that part of the reason that you wanted this bill?
I did have a list in my other committee, and I'm trying to see if I have it here in my notes. Let me see. I had a list. I don't have those numbers with me right now, but this is a part of another package deal that we did together out of the House with Delegate McQuinn and Delegate Candy Monday King. And so we all carried these bills together and talked about it. And I think Delegate Candy King had the actual list. But the reality is not everyone knows that they are carriers of the trait. And some people don't even know that they have sickle cell disease. So that's what this bill would seek to do, for us to get a better handle on who in the Commonwealth has it and how we can provide them with the services they need.
Senator Evans has a question.
Yeah, I just wanted to suggest if this moves forward before we get to full committee, you may wish to find out what they're doing in other states with privacy. I do work outside the legislature for a medical registry that has de-identified data, and it may be different for sickle cell than cancer.
Okay.
But maybe to find out in other states about the confidentiality and privacy of the data.
Yes, sir.
Thank you.
Okay, well, there's a motion to report in a second. So all in favor of that, say aye. Aye. Any opposed? Okay, this is one that will go to full committee. It's not in our budget, so I don't know, but I know that the chair expressed some concern about it before.
Okay. And I will speak with her. Thank you, Mr. Chair, members of the committee.
Delegate Shin's not here yet. Delegate Delaney's House Bill 1366 is an administration bill. It requires background checks criminal background checks for local boards of social services. It includes money, and our money is already included in the introduced budget for the Department of Social Services to perform this feat. Senator Favola.
We heard this in rehabilitation and social services and learned that the bill that Delegate Delaney has submitted actually it conforms to many practices throughout the country on the criminal background checks for Child Protective Service workers. So,
The question is,
Senator Reeves.
Barbara, are they going to use the state police
about that program, so it's cheaper for them to do that program.
They did not state that in the legislation. They just said they were going to do the background checks. And we had, Carl Ayers said that actually it's required and it's part of the federal backdrop. Here he is.
Good morning, Mr. Chair and committee members. So this comes from an IRS federal audit. And so what they said is that traditionally we have only done background checks on TANF workers. But because of the way our benefit eligibility system is written, is that they are now requiring us to do those background checks on all of our eligibility staff. So the legislation that's before you, same practice that we currently have. It doesn't change the practice for anybody. It just requires background checks for all of the eligibility staff instead of just the ones that did TANF cases. Okay. That's all the legislation does.
Are y'all using the RAPAD program, that new program that the FBI's put out to move all the schools everywhere?
Mr. Chair, Senator Reeves, I don't believe so. We just use the federal fingerprint background checks is what we use, and then we have a vendor that we send everybody through to do those called Field Print that does those. But specifically the type of check that they do, I can't answer that. Sure. Talk it offline. Okay. Yeah. Thank you, Mr. Chair.
Is there a motion on the bill?
I move to report. Second.
Motion and a second to report the bill. All in favor, say aye. Aye. Okay. That bill's done. We've got the one bill from Delegate Shin. We've got one from Delegate Clark. We've got one from Delegate Cousins. Delegate Shin's here. Good.
Welcome back. Thank you. Good morning. Good morning, Mr. Chairman and members. You've got House Bill 908.
908. And
Yes,
this
sir.
bill is similar to Senator Evans' 676, which passed the Senate 40 to nothing. We were thinking about changing, this bill has an expiration date of July 1 next year.
Yes,
We
sir.
were thinking about changing that to July 1, 2026. The 1 year is not enough time.
I would really appreciate changing that to July
Okay.
1st, 2026.
Okay, all in favor, say aye. Okay. Other than that, the bill increases the number of individuals on the wait list for the DD waiver. It could because, and that's really what you're trying to figure out.
Sure. I think that was what Senator Favola was concerned about, and so that's why we've put the sunset clause in it to give it time to study and ask DMAS to report back how many folks are impacted by this.
Oh, and you will take care of making sure the same amendment goes on Senator Evans' bill over.
Yes. So Senator Evans' bill passed out of the full Health and Human Services Committee on the House side, and so we'll make sure that it gets amended on the floor to be in alignment when they pass.
Okay. This has to do with a handful of people, probably not that many that are making Social Security.
Mr. Chairman,
Yes.
me?
Senator Pavola. Okay, we've got.
Thank you. Yeah, Mr. Chairman, I'm going to move a report this as amended, and I feel very good about this because we will be able to continue those who are currently receiving the SSDI waiver until we figure out exactly what the impact is. So I think this is the right thing to do.
Okay, I had a motion and a second to report. All in favor, say aye.
Aye.
Okay, thank you very much.
Thank you, Mr. Chairman.
Okay, Delegate Clark and Delegate Cousins, I think, are the two that we have left. Do we have any anticipation that they're not going to come? Okay. Yeah, Delegate Clark's bill is Senate Bill 34. What that does is it takes the debt on medical debt statute of limitations down from 5 years to 3 years. Okay. Okay. You're from DMAS? Okay, come on up.
Chairman, members of the committee, my name is Brian McCormick. I'm the Director of Legislative and Intergovernmental Affairs at DMAS. I wanted to tell the committee about a concern that we raised, and I appreciate the committee being willing to hear me out on the 11th hour on this bill. DMAS we have 2 statutes that require us to go to collect benefits that were obtained either by fraud or by mistake for medical bills that we've covered. And we also have the now famous settlement lien statute that requires us to go to get back costs that were paid out by Medicaid for injuries in an accident that are the subject of either a civil judgment or a settlement. The bill as written, the definition of medical debt is debt that arises from the receipt of healthcare services and that was originally owed to a healthcare provider. The debt that Medicaid is going after under all 3 of these statutes is debt that was created because of medical services received and that were owed to the provider at the time the services were provided. DMAS paid for those in each case. Our 2 statutes that deal with recoveries from individuals or institutions, both of those have a 6-year statute of limitations in which DMAS needs to bring that. The 3-year limitation that this bill puts forward would be in conflict with that. And in each case, it could extinguish the debt before, in cases of fraud or whatever. DMAS may not even be aware that the fraud occurred within that 3-year time period, and so we wouldn't be able to, make that collection and pay back, the feds. And the same with lien settlements. In some cases where you have a serious injury, the treatment for those injuries can extend beyond the 3-year period. Before there's a civil judgment or a settlement. And so in cases like that, part or all of that debt could extinguish before DMAS has a chance to collect it. So what we're asking is for the committee to consider an amendment to the bill that would either exclude DMAS entirely or would exclude DMAS's collection of Medicaid debt under the 3 statutes in which we're required to do so.
So, Mr. Chairman?
Senator Evans.
So an amendment to exclude Medicaid debt from this bill would satisfy you? That would be?
It would, Senator.
Okay.
Well, I guess, Mr. Chairman, I would move that. Oh, thank you. I would move that amendment.
Senator Favola, Senator Evans.
I would ask the DLS staff to suggest where it would go, but I guess I would put it somewhere after B.
Chairman, if I may, I have
You have the amendment?
I have 2 choices, one that excludes Medicaid, the other excludes it under the 3 statutes. I'm happy to share that proposed amendment.
I would ask.
Senator Obenshain has something that.
Comment on that?
Sure.
I think he's exactly right about the liens. If you wait 2 years for the statute of limitations, file a lawsuit right before the expiration of the statute and just run the clock out for a year. But I don't know that amendment satisfies all of the issues that might arise. What about University of Virginia medical debt that isn't covered by Medicaid or VCU or others?
My understanding is both VCU and UVA had a chance to look at this bill and didn't express concerns.
And part of that may be that.
Yeah, sure.
Oh, Senator Chairman, that may be in part because the way the bill is structured, there is an exception for payment plans for hospitals and other providers that would not apply to DMAS. So even though a lot of this debt we collect over a period of time with a payment plan, that option isn't available to us under the bill.
Mike, you.
Yeah, Mr. Chairman, so we did hear from both VCU Health and UVA Health. So VCU Health actually, with the payment plan amendment that was added to it, feel better about the bill because that basically means that they wouldn't be caught up in the 3 years. So I think it generally aligns with what they're doing now. UVA Health, of course, indicated that it could affect future collections and impact the debt set-off program. But those were just the comments that came back from the 2 teaching hospitals.
You don't think the
Mr. Chairman,
Senator Fola?
I carried the medical debt bill 2 years ago, and we did work with VCU and the state hospitals, as well as the VHHA and other private hospitals. I think it's important to have a limitation, but I do understand the DMAS issue. I don't know which amendment version you would prefer, but I think the broader provision would be my preference.
Mr. Chair, I would.
And again, I'm happy to share this, Mr. Chairman, with the committee.
If you share it with Stephen, that's fine.
Mr. Chair, I would say that it seems clearer and cleaner to just go with the first one, since we don't know what the fiscal impact would be for the Department of Medical Assistance Services. I would move that we adopt that amendment.
The first one is more clear. Okay, all in favor of that amendment, say aye. Aye. Opposed? Okay. The bill is before the committee. I don't really like to kill a bill with a patron not here, but they've had about a half hour to get here, and they're not here. So is there a motion on the bill? Motion to report in a second. All in favor, say aye. Aye. Opposed? 2 noes. Okay. The last bill we've got comes from Delegate Cousins, and it's in kind of a posture that I really wish she was here because it's identical or nearly identical to Senate Bill 490 from Delegate Aird that she struck because of the fiscal impact. And the House budget includes $115,000 a year for 831. It's a maternal mortality review. But Aird had it and struck it because of the fiscal impact. We don't know whether Cousins is going to be here or not.
Mr. Chairman, I would agree.
Okay, well, I will entertain a motion.
Carried over for you.
Second.
Okay, all in favor of that, say aye.
Aye.
And if the patron doesn't like that, she can come to the full committee and we can fight it out there. I think we're done.
Thank you.
The Senate of Virginia, Richmond, Virginia.